Thoughtful, articulate, artist, gifted, grammatical. Circular sources brimming with rich, flammable food for your thoughts, plated a different animal. Rounds on me, keep tabs, we insurmountable. Swerve, hey, Merle.
Everybody, welcome to another episode of What's on Your Mind. It's Tuesday, so it's my weekly live about mental health. I'm so excited. Today I have Dr. Paula Freedman joining me. Oh, there she is. And we're going to talk about eating disordered and disordered eating and how that affects your mental health. Oh, perfect. Hi.
Hi.
Can you hear me okay?
I can. Can you hear me?
Yep, you're perfect.
Awesome. I have not gone live in a very long time, so I forgot how all the technology worked.
Well, thank you for joining. I appreciate it. I was letting everybody know, for those who may not know, my name is Nimade, and can you hear me okay? There's a lot of noise in the background. Normally it's pretty quiet, but you can hear me all right?
Oh, is it on my end, do you think?
No, it's on my end.
Oh,
There's like people in the hallway,
Oh.
so I'm hearing a lot of noise. I just want to make sure you couldn't hear it.
No, I can't hear it. I only hear you.
Okay.
I think we're
Okay,
good.
So my name is Imane. I do lives during the week and throughout the month for what Let's Talk Live on different topics. This month I've been highlighting women for Women's History Month, and on Tuesday nights I do lives about mental health, about different topics. And tonight we're talking about eating disorders with Dr. Paula Freedman. Do you want to introduce yourself a little bit?
Sure, yeah. So my name's Paula Freedman. I'm a licensed clinical psychologist and a certified intuitive eating counselor. I have a private practice. I live in Chicago, and my practice is called Humankind Psych, and we specialize in eating disorders and anxiety. My background before that was in addiction, and that kind of like led me I went sort of from the addiction world into the eating disorder world, which actually have quite a bit of overlap. And I'm trying to think what else. I also train and mentor graduate students in psychology. So I love working with like baby therapists and helping kind of shape them and get them excited to go into the field. And yeah, that's kind of me in a nutshell, I guess.
That's awesome.
Yeah.
So to kick things off, you mentioned that you are certified in intuitive eating, and I think that that's something that we hear a lot, but like what exactly is intuitive eating?
Yeah, I feel like it's kind of become like more trendy lately, which makes me excited that like more people are talking about it, but I also think there's a lot of like misunderstanding about what it actually is. I think probably the simplest way to describe it is that it's a self-care framework for eating. So it's a way of approaching food. Really, it's something that like we're all born with. We're all born knowing how to honor our body's needs for food. If you think about just like really, even an infant, they cry when they're hungry. Like they will let you know when they need to eat, and then they'll also like kind of just turn their head away when they're done. And so we're all born knowing how to honor our internal cues, but those things get conditioned out of us as we go through life a lot of times, especially if like from a young age you had your food kind of controlled by your caregivers or people around you, or maybe you were put on a diet at a young age, or you were taught that certain foods are good and healthy for you, and certain foods are bad, and like these foods are like only special foods that like are a treat and things that you need to earn. Eat your vegetables and then you can have dessert. Like we all start to sort of internalize these outside messages, and that disconnects us from our body, and that disconnects us from that inner wisdom. So intuitive eating is a process of reconnecting with ourselves and bringing eating back to being an inside job instead of like an outside job. That's
okay. So it's
does
just
that make
going
sense?
more off of like more off of how you feel, because I know as you get older, like we get programmed to have like lunch, like breakfast, lunch, dinner, like your three meals a day, 3 times a day, and you don't really listen to yourself. You're just like, these are the times that I eat and what I eat, and that's that.
Yeah, like I see someone in the chat said, or the food/plate police, right? Like you start to get all these rules. I have to eat at this time, and oh, I'm hungry, but it's not lunchtime yet, so I can't eat yet. Or oh, like I already had cookie today, so I can't have another one. Or just like
or
all
like
kinds
clear
of
your
rules.
plate. Like that's a huge one for
Yes.
me. Like I don't have kids, but if I had kids, that would be a huge one for me because it teaches you to not listen to your body. You're just like,
Yeah,
you have to eat what's on your plate, whether you feel full or not. And then that develops into stuff later.
exactly. It teaches you to like not pay attention to when you're feeling full. It's like, oh, well, you're done eating once all the food is gone. And maybe, I mean, maybe you want all the food, but like maybe you also only like wanted some of it and then you feel full and you're done. And so, yeah, like when we teach kids all of these clean your plate or, you know, eat this and then you can have that, or even like rewarding people, like, you know, a lot of times kids get like food is like a reward. It's like if you,
Hmm.
you know, do your homework, you can have a cookie, and it teaches you like to associate things like other things with eating, you know, instead of
Right.
letting it be just like peaceful and comfortable, and food is just food, you know?
Yeah, and I think we don't really think about that as we're eating like that. We also put like a morality on it because you're right. There's like
Yes.
good food and bad food, and then we like reward ourselves with foods, and instead of it just being like a thing.
Yeah, even like the language, like you were saying, good and bad, like people talk about like other people's eating. Oh, like you're, oh, you ordered the salad, you're being so good, or you know, and it's like,
Yeah.
no, maybe they just wanted a salad. Or I mean, and it probably did have some morality attached to it, but
Yeah.
you know.
Well, I think that that's bad too because like for me, like with me, and I've been like thinking about it and talking about. I'm always on this like constant journey to try to fix myself, but like,
I
um,
hear you.
with like for salad because I love that you mentioned that example because it ends up being like this diet food, right? And for a while it was like, well, I only eat it when I'm on a diet. So it'd be like, oh, I have to have salad. But then I'm like, but wait, I actually like it. Like I actually enjoy it. But because in my mind I've now made it this diet food, it's this thing that I'm like,
Mhm.
I don't look forward to it or I don't want it when it's actually something that I like. And I feel like there's so many things like that that we correlate certain things to that they don't
Yeah,
need that.
apples. A lot of people feel that way about apples because there's, I feel like it was like popular for a while to like, if you're hungry, just eat an apple. Like if you're, you
Yeah.
know, like I
An
feel like
apple
it
a
was
day
like a
keeps
thing.
keeps the doctor away.
Yeah, like apples will satisfy you. So like if you are craving, you know, sugar or something sweet, like have an apple instead. And then like I've had all these clients come to me and they're like, I never crave an apple, like because I'm like just I'm so over apples, you know. Same with like
Mhm.
salad. It's like, ugh, I used to force myself to have a salad. Now it's not like it's the last thing I want. But
Yeah.
like you said, it's like these foods are not, they can be delicious, they can be enjoyable. Like maybe if you left yourself to your own devices, you would crave it at some point, you know? So
Yeah, someone says salad is so refreshing to them. Yeah, like I had to really come around and be like, oh wait, I do actually enjoy having salads. It's not that bad.
yeah, I like a specific, I mean, I don't want to say specific, but like I think what I learned because I kind of went through this process myself with intuitive eating is that like I don't I don't like, I like certain salads. Like I like salads that have like all the fun stuff on it, you know? Like
Yeah,
I think the way I used to eat it was like dressing on the side, and you can't have like the croutons and the crispy onions and the cheese and all the
yeah,
stuff that like makes it delicious, you know? So it's like
yeah,
also allowing for satisfaction in your food, and like that makes all the difference.
yeah,
So,
absolutely. Something I wanted to ask you. So, we all know the phrase eating disorders and kind
yep.
of in general what they are. But something that I've heard of recently is disordered eating. So, can you
Yeah.
tell us the difference between an eating disorder and disordered eating?
Yeah, and I for some reason I get excited when people ask me this question. I know it's like probably not the most, it's not like a glamorous topic or anything, but I find I because I think it speaks to the larger like way that I like to think about all mental health concerns, which is that it's along a spectrum. So like
Hmm.
anything, an eating disorder versus disordered eating, or like depression versus maybe like periods of low motivation and feeling sad, right? Like it's all along a spectrum. So if you think of um your eating behaviors, like over here you have just someone who maybe eats intuitively, like they eat when they're hungry, they generally stop when they're full, they don't really have any rules around food, they just like food is kind of just like easy and they don't really think that much about it. That's on one end of the spectrum. Then on the other end of the spectrum you have someone who has like a full-blown eating disorder, like a clinical diagnosis, and that would be something like anorexia nervosa, bulimia, binge eating, where like their relationship with food involves a lot of extremes, whether it's like a lot of restriction, binging and purging, that sort of thing. And then there's sort of like more in between, like in that gray area where somebody doesn't quite have an eating disorder, but they still have maybe some like a fraught relationship with food, like, or with exercise, or both. So like maybe they are like counting and tracking all of their macros, and they kind of like calculate every bite that they eat, and they have rules about like when they're allowed to eat certain foods, or maybe they're like kind of stuck on like their Fitbit or like fitness tracker, right? Like I have to close the circles every day. So
So would you put like
yeah.
anyone who's like really restrictive with their eating and disordered eating? So like when people go on diets and
Yeah.
stuff where they're counting, where they're doing like intermittent fasting, does like all that stuff get put into disordered eating?
That's how I would conceptualize it. And I think that's what's tricky too, is that like if you said that to someone who is on a diet, a lot of times people are like, what are you talking about? You know? But it's really the role that food has in your life, I guess. Like how you, and the amount of time, energy, money, brain space you're putting into it. And yeah, I think for a lot of people that is like a diet, intermittent fasting, Whole30, right? Like I would think about those as disordered eating. I mean, I'm not obviously diagnosing anybody over social media. I feel like I always have to be clear about that, because like whenever I post on Instagram or TikTok and I'm talking about anything in this like category, people are like, so you're saying I have an eating disorder because I'm vegan? And I'm like, no, I'm not saying that. I don't even know you. Like
Right.
let's relax, you know, because it's also about what resonates for you, and like how much energy it's taking up in your life. If you're, you know, eating a certain way and it doesn't have a negative effect on your life, and it doesn't have a negative effect on your health, and like everything's fine for you, then who am I to tell you that you have a disorder, you know?
Right. I think it's just
So
mostly that when you're in those phases, like, and I'm one of those, like, I've been yo-yo dieting my whole life, and it's actually, like, I realize it's part of the problem, because sometimes I'm like, man, if I had never been put on one and I had just been, like, healthy and, like, I was always chunkier than normal, but, like, I did tennis, I did track, like, I was really, like,
mm-hmm.
in shape, but it was because I was chunkier. It's like, let's put her on a diet. So I think, like, I
Right.
was in middle school when I did my first Weight Watchers, and,
Oh
like,
my
by high school,
God.
I started diet pills. So, like, the
It breaks my
yo-yoing of it,
heart. That's so young.
yeah, it's breaks mine too. Um, but yeah, so like I do know that like whenever you're on like those diets, it feels so all consuming. Like that's all you're thinking
Mm-hmm.
about, and it becomes like this obsessive thing, and it's very frustrating.
Yeah. And I think it's a slippery slope, right? Because when you're on these diets, there's only two ways it could go. Either it's going to swing all the way the other extreme, right? Where it's like, okay, I've been like restricting and I've been counting and I've been like good and following all the rules until eventually like I crack and I cave and I go all the way the other way. Or it's going to slide all the way back down that spectrum to an eating disorder, you know?
Mhm.
But like
Yeah.
it can only go on for so long because your body's not getting enough of what it needs. So it's like going to fight you back, you know?
Yeah, and that's always what happened with me is I'd go on like these super restrictive things and it'd work for a while and then I'd lose it, but then I'd gain it back plus because my body was like, oh, finally
Yeah.
food and things and stuff.
And
So
that's like science, you know, like that's your body trying to protect you, because your body doesn't know the difference between like intentional and unintentional like restriction. Like your body doesn't know whether it's in a famine or whether it's on a diet. Your body just know, like your body's not like, you know, thinking logically, right? It's just like, I'm
right,
not getting enough food, this must be a famine, let me drive this person to find food. And then once you start
let
eating
me
again,
store it.
it's,
Yeah.
yeah, exactly. Because what if there's another famine? So it's protective. It's actually kind of like brilliant and amazing that our bodies do this, you know, but
Yeah, I guess.
we shouldn't. I know. That's like such a
It's like,
major
thank you,
reframe from,
body.
I know. Well, but like that's our messed up culture that's saying, you know, otherwise, right? That like you should have
Yeah,
had to lose, that you should lose weight in the first place. Because like nothing was wrong with your body. Nothing is wrong with anyone. Like I don't say nothing is wrong, but you know, um,
yeah.
oh, my husband is standing outside of the window and
Um,
telling me to move the camera because he couldn't see my whole face.
oh,
That's so funny. That's
I love that
crazy.
he's watching. Hello.
Yeah,
Someone
hi.
asked, would orthorexia be considered disordered eating? I don't even know what that is.
Yeah, so orthorexia is one of the newer eating disorder diagnoses. It's actually not even in our diagnostic manual yet, the DSM. It's because it's still like newer and there's still like building up research around it. But yeah, orthorexia is like an obsession with like clean eating or like healthy eating. So it's like instead of being focused on eating as little as possible, which would be something like anorexia, the focus is on eating only like certain like healthy foods or the most nutritious foods, or like I can only eat things that are like completely plant-based, or like it can look a lot of different ways, but the fixation is on like the healthiness of food.
So
Yeah.
would that be a disorder? Because it seems like that would be a good thing.
Well, I mean, I think anything can turn into like destructive, you know what I mean?
Yeah.
Like there's nothing, I mean, yeah, it can be a positive thing to like take an interest in your health and like pay attention to what you're eating and how different foods make your body feel. Where it crosses the line is like when it becomes rules and like rigid and like stressful, right? Like a lot of like people who develop orthorexia a lot of times will be afraid, like actually like panic if they break one of their like food rules, or if like there's a cupcake or something processed or whatever, like so like your relationship with food actually like has an effect on your health, sometimes even to a greater extent than the nutritional value of the food. Like if you're stressed out while you're eating a cookie or stressed out while you're eating, like that stress is like just as bad for your health as whatever stuff is in the food, so
Right, makes sense.
yeah. And like, oh, sorry, go ahead.
No, go ahead.
Well, I was going to say the other thing about orthorexia that I find that can be really interesting is it can extend like beyond just food. So it could extend to like the products you use, your makeup, your lotions, your soaps, like everything having to be like pure. So it almost has like an OCD kind of like vibe to it in a way sometimes.
Yeah. Well, and you mentioned that a lot of things like that cross over from like your addiction training, and your addiction moved over into food disorders, which would make sense because it's a form of addiction for some people.
Yeah, some people in psychology call it like a process addiction, like eating disorders, because it's like it's not a substance. Like food doesn't have the same properties as like alcohol or a drug, where it's gonna like it doesn't have the same effects in your brain and like kind of hijack the same parts of the brain, but the purposes served by it like can be similar. So like I'm really fascinated with like the human like desire for control, how like we really strive to have control over our inner world, like we all try to control like what we're feeling inside, what thoughts come into our minds, like that sort of thing. And I think people we turn to drugs, alcohol, food, whether food in terms of like trying to eat like less of it and control how much you're eating, or food in terms of like numbing out with food, like all to try to control how we feel inside. Does that make sense? I feel like it's kind of abstract, but like
no, it does. And I think that we do try to, because I feel like there's so much that's out of our control that we tend to try to control what we can, and that tends to be food thing. I think when I first learned about like anorexia and bulimia and stuff like that they were taught about it from the control aspect of it. And I mean, I know it's bad, but I remember being younger, being like, oh, I wish I had the discipline to do that. Like, I wish I had the ability to have that type of control over myself.
Yeah, but again, I think that speaks more to the culture and the world around us that like treats that like it's a good thing to like override your inner signals and to like deny yourself of like pleasure and all of that, like I think you're in good company, like that thought came in your mind, because it's like it's praised by the culture, even not even just to like, I don't know, this might be a little of a tangent, but like even just like this like discipline, this like idea that like we're supposed to be this like work robots who like wake up and we like fill our day with only productive things, and like this idea that like that's good, if you're like hustling you're good, and like you're doing a good job. And if you're like sitting on the couch scrolling on your phone, then like you
And
suck,
you're a bad
you know?
person.
Yeah.
Yeah.
You're
Yeah.
lazy or whatever.
And we
And it's
beat
like,
ourselves about.
yeah, like no one is built to just like work 24/7. Like just like it's not sustainable to only eat kale for the rest of your life either. Like none of that is sustainable. So
Right. You mentioned like the parts in your brains that flare up from like alcohol and drugs and things. Does that same effect kind of happen with like binge eaters, like people who binge eat? Is that why it's so hard for them to not?
so binge eating is interesting because that's one theory, and that's not the theory I subscribe to, that it's like food addiction, because a lot of binging actually is a response to restriction. So like, you know how we were talking about how like when you go on the diet, you can only stay on it for so long before you like go the other way. That's sort
Yeah.
of how binge eating tends to work, is that maybe you're eating a really like rigid way throughout the day, and then at night you kind of like slip up
Yeah.
and go to town on all the foods that you like aren't supposed to have. Or the other thing that happens is called like psychological deprivation. So like you might not actually be restricting yourself during the day, or I'm just using during the day as an example because a lot of times people binge at night.
Yeah.
But like maybe you're eating whatever you want, but like you're beating yourself up about it. So then it still feels like you're deprived. So like if you shame yourself while you're eating whatever cake, and you're like,
Mhm.
I shouldn't be eating this. I'm so gross. Like I'm the worst. Whatever. Like psychologically, you still come away from it feeling like you didn't really get to eat it. So you still feel
Yeah.
deprived. So you're still driven to keep eating it. Does that make
So
sense?
you're not getting like the high of
Yeah.
the other one. It's still kind of in that low.
Right. And when I said like the brain mechanisms are different, it's like there's no like with drugs you build like tolerance, right?
Mhm.
And you go through withdrawals. And you know, with eating it's not like that. Like
Yeah.
you don't have like a higher tolerance for
For eating,
cookies
you
just
just
because
eat.
you
Yeah.
ate.
I mean, I
Yeah.
feel like that's always been
Yeah.
one of the hard things with foods. Is like you can't just be like, well, I'm just not going to eat. Like you have to at some point. Like you have to eat. Like there's no, you can avoid alcohol,
Right.
you can avoid drugs, you can't avoid food.
Right. You can't like go the abstinence route. You can't be like sober from eating like you could
Yeah.
from, yeah, cocaine or whatever else it is. Like, and that's I think one of the tricky parts of recovering from an eating disorder, is that it's something you have to face like every few hours every day for the rest of your life.
Yeah.
So
And I think that's something that's been talked about more, which is good, is that when we picture like anorexia and bulimia, we obviously picture very small people. When we picture binge eating, we picture very large people. But people can be both sides on either sides of it. And
yes.
it's incredibly hard for people who are larger to get people to understand that they might be anorexic and they might be bulimic, even though they're a bigger size.
Mhm. Yeah, and I feel, and like that is one of the things that I wish I knew like earlier in my career too, because I was trained like a lot of people are to only really pay attention to weight and body size, and like that's what makes like you only
Mhm.
really need to be concerned about someone maybe having an eating disorder if they're super thin, and that's not the case at all. I mean, I got terrible training and education around eating disorders, and I think unfortunately that's true for a lot of mental health professionals, which is part of why this is like my specialty and something that I try so hard to educate people on and like spread the word, I guess, right? Because it's like so many people are suffering I mean, I have clients who are like they never lost enough weight to be, like have
Mhm.
people like freak out because of like what we're all taught, like they're in a larger body, and for 15, 20 years of their life have been restricting or binging and purging and dealing with this stuff. And it's like, that's, we're doing, I mean, I'm speaking on behalf of providers, like providers are doing people a disservice by
Mhm.
not recognizing these things and like praising weight loss and being like, oh, like that's great that you lost weight, instead of being like, like how much are you eating? Like, let's explore what you're actually doing and get a sense of what's going on. And also like listening to their patients. People don't do that. I'm not saying I'm perfect at it, but that's it.
Yeah.
Like, yeah, I think just taking people seriously. And like you're saying, it's like it doesn't even resonate sometimes for the person who has the eating disorder that they have an eating disorder, you know?
Well, I mean, especially if you're being praised for it. That's the thing too. Like when you're in a bigger body, the minute you start losing weight, everyone's like, "Oh my gosh, you look great, you look fantastic." So no one's really
Keep it
like
up.
questioning the fact that you're eating like very little. And honestly, a lot of people that I've talked to, like their thinnest points where people praise them the most were when they were going through like the worst things in their lives. But like we're so pre-programmed to think thinner is better that it doesn't matter how they got there. We're just happy and proud of them for getting there.
And we also are programmed to think that it's healthy. Like it's healthy to be thin
Yeah,
no matter how you got there. And
right.
really it's not. I mean, it's dangerous. Like someone at a higher weight can still like die from an eating disorder. You can still get
Yeah,
all of the malnutrition problems. You can still have like all of the cognitive problems. You can still have like the vitamin deficiencies, like everything that happens to someone when they're malnourished can
yeah.
happen to someone even if they aren't thin. So it's
Yeah.
like it's really warped that like we're taught to think about weight
Yeah.
only.
Well, because I remember like one of the largest times where like I lost the biggest chunk of weight was in high school, like my junior year, like the summer between, I think before my junior year, yeah, before junior year. But like I was barely eating. Like I was riding my bike like outside like twice a day and barely eating throughout the day. But everyone was like, "You look so great. You're so, you look fabulous." Because in their minds, like I was getting smaller, so I must be being
Mm.
healthier. But I probably was so malnourished, which is probably also why, like, the minute I stopped it when school started again, I gained it all right back. Plus,
Mm. Yeah, because your body was probably like desperate for more energy. It's like, yeah. And like that really, I feel like I mean, it messes with your head too, to hear praise for doing something that's really like hurting yourself.
yeah, yeah. I imagine that's probably why people have a harder time breaking away from it. I do like that we're talking about it more. Like I'm
Yeah.
addicted to Bravo, so I'm always watching and referencing
Oh,
Bravo.
yes.
But the Real Housewives of New Jersey, one of the women has an eating disorder, and she's been struggling with it like her whole life, and she's gotten better. And then last year there were some rumors about her husband, and so it seems like it's picked back up again for
Mm.
her. So they're trying to like her husband's like, "You should go to a place and get help," and she's like, "I don't really want to. I don't need it." But I'm glad they're at least talking about it because I think there's a lot of stuff that we just all think that we're the only ones dealing with it, right? Like before I started being more honest about like my depression and anxiety, it's like I don't want people to
Mhm.
know, I don't want to talk about it. And then the minute you start talking about it, there's a bunch of people who'll be like, "Oh, thank goodness. It's so good to hear
Yeah.
someone else talk about it."
And I feel like that's the whole like shame and vulnerability thing, right? That like shame grows in silence. And as soon as you start speaking about something, you realize you're not alone. And every person on the planet maybe hasn't gone through the same things as you, but has felt the same emotions as you at some point. And like,
Right.
yeah, I I agree. I used to think, well, before I got into this field, especially like something was wrong with me. Like, why
Yeah.
am I always, having panic attack? I mean, I didn't even have the language to know they were panic attacks, but just
Right.
you think you're not like normal, and then you realize like there's no such thing as normal, and all
So,
humans struggle.
yeah, absolutely. You mentioned that when you were first trained, were trained really well in dealing with eating disorders and what to
Yeah.
look for. And I think that that's definitely an issue. One of the guests that I heard earlier this month, Jamie, she mentioned that when she went to get help, they just assumed that she had binge eating, and that really wasn't her problem. And so they weren't treating her well, for what she actually needed help
Mm-hmm.
with. But you said that you now have to work with new therapists and help
Mm-hmm.
train them, which I think is awesome. But like, what are some things that are being done like overall to help
Mm-hmm.
changing that school of thought amongst therapists?
Yeah, I think that's a good question, and I wish I could say there was more going on. So every year in my practice, I have like a small kind of training class of grad students, and they come from different like grad school programs in the Chicago area. And I ask them every single year, I'm like, is there a class on eating disorders? Like, have you, and it's the answer is always no. And I'm like, oh, maybe I should go teach, but I don't really want to. But yeah, it's still not like integrated into the training programs in the way that I think it should be. I think it needs to be like included just as much as the education that we get on other topics, but especially because it's so common, you know, and it's like we're taught and trained on how to treat so many different disorders and mental health concerns, and some of them are even rarer than eating concerns. But anyway, that's kind of my tangent. What's being done, I do think that there's more conversation happening. I think social media like is actually helping, which I don't know. I have a very love-hate relationship with social media. I'm like a little bit addicted, but also like every few days I want to throw my phone out the window.
It's like the best and the worst. Yeah.
Exactly. It's like so extreme, but I do think that it has really like allowed for a lot more conversation about eating disorders, about body image. I think all of the like whistleblower stuff that came out about like how these social media platforms are making people are increasing like body image concerns and eating concerns is helping like at least just open the door. I know there's a little bit more research happening like in psychology, but I think we have a really long way to go. Like I really think that it needs to become like standard practice for every therapist to be trained in eating disorder work, and just at a minimum, even if it's not going to be your specialty. And I think it needs to be part of like standard intake processes. Like, you know, when you go to the doctor and they do the intake and they get your history and everything, like they always ask you about smoking. They always ask you about your drinking. You know, they ask you about these things that we know are important to be assessing, but not necessarily about like your relationship with food or your physical activity. And just by asking those simple questions, we can start to like recognize red flags better. So
yeah,
I feel
absolutely.
like I have ideas for where we need to go. We're just not going there yet.
Right. Well, and speaking of red flags, like what are some red flags that people can look for either with others or with themselves that's like, well, maybe I should go get help, or maybe this is too extreme?
I think for yourself, it's important to be honest with yourself because, you know, obviously defense mechanisms are by nature, like they're unconscious. Like you don't a lot of times realize that you're like in denial, you know, until you're not in denial of something anymore. But being honest and like taking a look at how much energy and time you spend thinking about food, you know, because realistically, I don't want to say how much you should spend, but like if your relationship with food is peaceful, then you're only really going to be thinking about it like when you're hungry, or maybe if like you have dinner plans you're excited for or something like that, but not all day every day, not, you know, like not when it's taking up all of this time and energy, freaking out if like some plans change, you know, like if something unexpected happens. Like I know, you know, like I'll hear clients like, oh, like I went into work today and someone, you know, brought like donuts into our morning meeting and like it like sent me into a tailspin or something like that. You know, like unexpected food being around like freaks you out. Like that's kind of a red flag. Just basically like the way that you approach food, is it causing you stress? You know, that would be probably the biggest thing to think about. Do you feel out of control? You know, when it comes to food. Same with exercise. I think that's another thing. Like people think like there's not like, oh, I'm just like a fit, active person. And it's like, but do you panic when like you can't have your routine? Do you, you know, like have a fixation on like the fitness tracker, or, you know, like do you have certain things that like maybe you're sore or you're tired or you're injured or you're sick and you still force yourself to do things, you know? Those would all be like red flags. And then for other people, like same kind of thing, right? Like if you hear someone being critical about like, I'm eating it's tricky because so much of this is like embedded in our culture, you know? So
as positives, right? There's so many like negatives that are even like the exercise thing and forcing yourself when you don't feel well. Like we know that you probably shouldn't, but in our culture, it's like, oh, well, that's good. You have discipline. That's what discipline
back
is,
to the
doing when you don't want
discipline.
to.
Exactly. Like back to the discipline thing. It's like people respect that and like admire that instead of being maybe concerned or just, you know, like having some empathy that maybe this person is like punishing themselves in a way that is really not, I mean, I'm not necessary, but like ultimately taking a toll on like their well-being. So
Yeah. I think it's just whenever we get into the extremes that it's a problem,
Yes.
and sometimes we have a hard time witnessing or acknowledging when it's gotten to that extreme level.
And I think, unfortunately, too, sometimes it has to get to that extreme level because I think a lot of times we're so disconnected from like our own needs and our own feelings and our own like inner worlds because of things like social media and like just the millions of stimuli all around us all day long, right? That it's
Yeah.
like people don't realize that they're tired till they're like crashing, or they don't realize that like they're sick until they're like really sick, or like,
Yeah.
so even
Like
just
we let
connecting
ourselves
better.
get to the burnout. It's like until you burnt out, you
Yeah,
just keep
you
going,
don't.
you keep pushing yourself.
It's like I'm fine. It's like, what really bothers me is that like I'm trying to think of what the like when someone's going through a hard time or something, and it's like, how are they doing, or how are you doing, and it's like, I'm staying busy, like that's like a good thing, and it's like,
Right.
like we wave it off and brush it off, like I'm just gonna go
Yeah,
until
I'm
I
pushing through it. Yeah.
pushing
Yeah,
through it. Yeah,
absolutely.
that's another one. It's like we have these like sayings and they're supposed to be like reassuring, but really I think, we're like upholding this idea that we need to just constantly be doing and bettering ourselves and punishing ourselves and like fitting into this box and
Yeah.
achieving. That's why I think a lot of my clients, like whether it's anxiety, eating disorder, or addiction, like a lot of times they all have this like drive for like, I have to always be achieving, I have to always be
Yeah.
like earning, and it's like, yeah.
Because like at some level we feel like we have to earn our worthiness because we're not taught enough that you're worthy just being. Like you don't always have to be on the grind, and you don't always have to be achieving stuff. Like you can create a life that makes you just feel happy and content every day, just chilling. It took me a while to kind of like realize that because we are taught like
Yes.
strive for better, strive for better. And I'm just like,
Hmm.
it's okay to just make your life and then just be happy.
Yes. Oh my God, that's me too. It takes me a lot. It's still sort of like I still get that in the back of my mind sometimes where it's like, you're not doing enough, or like this person's doing more stuff. And it's
Yeah.
like, life is short. Like we're all gonna die anyway. Like I hate
Yeah.
to be morbid, but that's the reality, is that like
Yeah.
time is limited anyway. So is that how you really want to spend it? Like,
Right.
and if it is, fine, but I
Yeah, I
mean,
mean, there's nothing wrong with having that if that's where your goals are, but I don't
yeah,
feel like, because I'm constantly trying to achieve stuff, but like,
yeah,
I think that we send the wrong message that everyone has to be like that all the time, and they don't. Like,
right,
you're okay chilling a little bit.
right. And we judge each other for that stuff too. And I think we judge probably because we're judging ourselves for like, you know,
Yeah,
not
absolutely. Well, I can't
being,
tell
yeah.
you how much I enjoyed talking to you
Oh my
today.
God,
Thank
me
you so much.
too. Time
I
just
appreciate
flew
your
by today.
time and your wisdom. It was great.
Yeah, I agree. I love talking to you. I feel like this has been a long time coming because I know we talked almost like a year ago about doing a
Yeah,
live, and then it
yeah.
didn't happen, and I'm like, I've
Yeah,
just
that's
been
true, because I think
following and
that was the
watching your other
first time.
conversations.
Yeah, because I think that was the first time I reached out was like May of
Uh-huh.
last year for the mental health one. So, but this is great, and I like I said, I definitely appreciate your time and sharing all of your knowledge.
Yeah, thanks for having me. Thanks for getting me to do this. I always feel so vulnerable going on these lives, and so I'm like happy for the push to come on and talk
Yeah,
and connect with someone else. And I love what you're doing. I watch so many of your lives. I feel like you cover such a great range of, it's
uh,
like there's something for everyone. So I
thank you.
appreciate it.
Yeah,
Yeah.
I'm inquisitive, so I've turned that into sharing that inquisitiveness with
I
everybody.
love that. And I can relate. I feel like I get to know everyone's like deep, dark secrets and like peek behind their curtain all day. And I'm like,
Yeah,
people are fascinating. So
they're
I can
so
totally
fascinating.
relate. Right.
Yeah, I
And
find people just so interesting. Everybody has a story, like even when you don't
yeah,
expect it, like they have like this. I don't know. I find people fascinating.
me too. And even when you don't think you could relate to anything about that, like it's like that person's so different from me. Like, what could I possibly understand about them? And then you start talking to them and you're like, oh, actually,
Yeah.
like
Yeah,
we're
I find
humans.
either I'll find something that I relate to, or like they just give me like a whole new perspective on something because I've
Yeah,
never thought of it that way. And they say it, I'm like, wow, okay, that's different. Yeah.
exactly. Yeah, man, we're, yeah,
Well,
never gets
thank
old.
you so much again.
Yeah.
And this will be saved. And if you're not following her, definitely do. I love your TikToks and your reels.
Oh, thank
They're
you.
relatable and fun. So thanks for making those.
Thank you. Yeah, thanks for having me. This was so much fun.
Absolutely. And thank you
Okay.
everybody who watched. And again, on Tuesdays, I do lives about mental health. And then throughout the month, I do lives on all different topics. So tune in. All right. Bye.
All right. Bye.